Dr. Jessie at the Doctors of Physical Therapy here. This month is Family Awareness Month. We've been seeing a lot of younger kids and younger people coming in as sports start to start up again, as we start getting active again. We've all had a tough year of being sitting down more than we'd like, and we've all been sitting down in places we don't usually do. The kitchen table, trying to find a new desk, sitting and doing for the kids homework on their bed or on their floor or wherever. And so what we've been seeing from that is the inactivity is starting to relate to some more injuries as people start getting more active. So the big thing that we've been focusing on is how to give you a couple tips to start working into becoming more active again, becoming more agile, and not getting hurt as you start to do it. So the first big thing, and that's what we often talk about with kids and parents alike, is posture. So like I said, we've been seeing a lot more kiddos in here because they've been able to adopt a posture to try and look at their screen all day long. So what we see is a lot of this posture right here with our head down and our shoulders rounded. So typically what I'll give cues for is try and think about there being a string at the very top of your head that is pulling you up towards the very top of the ceiling. We all know that everyone can't sit like this for very long, but the idea is to slowly start to cue our muscles to try and get into this position. Similarly, what I've been telling all my kids is take as many breaks as possible. I know we tell this to our adults that sit all the time too, but it's really important with kids because kids are supposed to be moving in what's called lots of different planes. They should be playing, they should be going back and forth here, up and down. As adults, we start going just forward and backwards. While we're still kids, we want to make sure they're still moving in different planes. So I've been telling kids 20 minutes a day, especially while it's still not too hot out here in Arizona, get outside, play. It doesn't have to be your specific sport. It doesn't have to be anything in particular. Just get outside and move. Because what happens is right now is we've been sitting for say 8 hours a day for schoolwork, and then kids are trying to go play 3 hours of soccer. So there's a disconnect between those two things in which we really need to bridge that gap. The third thing is just stretching and trying to open up mostly chest as well as hips. So when I have kids at the desk, a lot of times what I'll have them do is just stretch as tall as possible here, trying to open up chest here, and then also trying to open up hips as well too. It's a lot of the same stretches we did at PEs as a kid. They still are good for just opening up our hips today. So doing a lot of reaching, a lot of opening up, and a lot of trying to stay as limber as possible, just so our muscles and our body gets used to moving in different ways other than hanging out here. So a lot of the tips and a lot of things I've said today sound really familiar to some moms and dads who have been sitting at their desks for long periods of times. Because we've been seeing these kids doing more of that as well too, we're gonna start reminding them of some of the things that their parents have often had to learn when they have to deal with back pain or neck pain or hip pain or anything like that. So the big thing as always at DPT is to keep on moving and moving well, making sure that you're staying away from or changing the postures that we know tend to cause a lot of pain and tend to make us feel really uncomfortable. So it's Family Awareness Month. If you have any kiddos that are starting to complain of any back pain or neck pain, or any spouses that are saying the same thing, please bring them on in here. We'd love to see them and talk to them and make the whole family fit and healthy.